To better understand the structural and functional differences in healthy versus dysfunctional tissues, we start out looking at a diagram of what is normal. Healthy, functional fibers of muscles, tendons, and ligaments run in a mostly straight line. They are able to stretch and contract within normal range of motion. Now when we look at dysfunctional tissue, scar tissue for example is never formed in a neat pattern, or one of which that allows function as it once was before injury. Scar tissue is laid down to repair soft tissue, much like superglue. Scar tissue strands makes bonds with every strand of soft tissue fibers to form a bridge over the gap. The tissue once functioned as a single unit. If there was an injury to the middle of the tissue and scar tissue formed over it, now the tissue functions as two separate units with a common anchor in the middle. This is why scar tissue must be so strong, because you have the pull in opposite directions from the scar. In the end, you end up with dysfunctional tissue. Another example is when you feel as if you have tight or achy muscles. When one fiber is not functioning as it should, for whatever the reason may be, other fibers are recruited to make up the difference, and then tend to bind to each other to compensate for the vector of pull on the muscle. The center of which they bind is typically referred to as a trigger point, and is also the typical location for where the nerve enters, the one of which that supplies the muscle. If this trigger point gets severe enough, it can compromise the nerve's ability to communicate with the muscle effectively, ultimately compromising the body's coordination, thus resulting in injury. In order to correct these fiber misalignments, we use the Graston instruments to work out the tissues to release them from their neighboring tissues. We work the tissues in all directions because their angle of attachment of all attaching fibers run in every which direction. It is a little like shaving. You are more effective at shaving when you shave against the grain, rather than with the grain, where the razor for the most part just skims across the hair. The same idea here, except the instruments are not nearly as sharp, nor are they intended to cut anything. We want to find the area of most restriction and work against it to work those tissues apart so that they can function independently like they were meant to work. The Graston technique is a good treatment option for virtually any patient who would benefit from soft tissue mobilization. After evaluation, soft tissue mobilization is used to release and lengthen tight, shortened, restricted tissue with the goal of restoring musculoskeletal balance and normalizing movement and posture. Those diagnosed with the following conditions have historically responded well to GT care. Patients with tennis elbow or golfer's elbow present with pain on either side of the elbow. Carpal tunnel syndrome, which we have previously mentioned, is characterized by pain and/or tingling in the hand. Neck and back pain. Plantar fasciitis, which presents as pain on the bottom of the foot, with or without heel pain. Rotator cuff strains present as pain on the shoulder, usually following an injury or repetitive stress. Various types of tendinitis or tendinosis, which is characterized by pain over the involved tendons, such as the patellar tendon or the Achilles tendon. Post-surgical and traumatic scars can be broken up with GT, leaving the site with a more functional tissue and a more appealing-looking scar. Acute and chronic sprains and strains, and bursitis, which can involve any of the bursa sacs in the body. GT is also very beneficial in athletics for pre-competition warm-up to increase muscle stretch and overall flexibility, which in turn results in increased muscle coordination and decreased likelihood of injury. Following competition, tight muscles and stiff joints are common. GT is also beneficial for ironing out these structures to promote proper blood flow back into the structures, thus decreasing recovery time. And if injury does occur, it is also beneficial for promoting the activation of fibroblasts, which are the building blocks of new tissue. By promoting proper tissue repair early, we can avoid the need to break up scar tissue later on in the recovery process. If swelling accompanies the injury, GT can be used to push the swelling out of the area and promote proper blood flow into the area to initiate the healing process. Here is a short demonstration of how we may treat carpal tunnel syndrome. Keep in mind, the typical treatment session lasts longer than the demonstration. This is a short demonstration of how we can treat plantar fasciitis. And this is a demonstration of how we can treat neck and shoulder pain associated with tight trap muscles and sensitive trigger points. Along with regular adjustments, the Graston technique is a great treatment option for anyone who has muscle or joint pain or dysfunction. By ridding the body of joint dysfunction, muscle imbalance, and fascial restrictions, normal biomechanics can be restored. When the body is able to function and move the way that it was designed, further injuries and lost time at work and at play can be prevented, and performance can be greatly enhanced. If you are one of those who have suffered from one or more of the previously mentioned conditions for an extended period of time, or have not seen improvement with your condition through medical treatment, conservative treatment through the use of the Graston technique may be what you have been looking for. We can treat your body's soft tissue and joint restrictions and help you lead an unrestricted, busy life. If you have any questions about the Graston technique, check out the GT website at www.grastontechnique.com or come in to Morris Chiropractic Health Source. You can bring this DVD in and use it as a coupon for a free personal consultation and examination to evaluate your condition, where we can decide if you would be a good candidate for this treatment option.